so much for joining us at Ward 86 at San Francisco General. Sorry to keep you all waiting, but there's always so many exciting things happening in San Francisco. Today, we are really here for a really important milestone, the release of our annual numbers of new HIV infections. And while it is still challenging in terms of talking about, just some of the issues that so many people in our community face, we know that the work that's being done by so many amazing people right here in Ward 86 in San Francisco General and other incredible organizations, which I'll mention shortly, will truly help us to reach what we know is a goal that we all have, and that is getting to zero HIV infections in San Francisco. And I am just really delighted that we in San Francisco since the 1980s have been at the forefront of pushing for innovative ways to change policies, new sciences and technologies to help us get to this milestone that we are so excited about today. And we are showing progress. Real progress, in fact. In 2018, for the first time ever, not only have we dropped diagnoses by 13%, but we have finally seen this number go below 200 for the first time ever, and that is significant. And it's progress that we should all be so proud of. This shows that when we work together with the community, with our policymakers, with our public health experts, our nonprofits, we can truly make a difference and save people's lives. And I'm really particularly proud of the Department of Public Health. They continue to show their commitment to innovative and groundbreaking public health solutions. And I also want to thank UCSF and the Getting the Zero Coalition and all the nonprofits and organizations in the room with us today who continue to show their commitment to addressing this issue as well. But even though we've reached this incredible milestone here in our city, we know that there are still disparities that exist specifically by race and ethnicity, by age, by gender, and sadly by housing status. These disparities highlight the work we have to do to continue to get to zero and really trying to remove the barriers, the stigma, the discrimination so that we can truly end new infections, which is our ultimate goal. In fact, in 2018, African American men had the highest HIV diagnosis rate, followed by Latino men. African American women had a much higher HIV diagnosis rate than women of any other race and ethnicity in 2018. And addressing these disparities must be our focus, and we are taking steps to do so. This week, the Department of Public Health will launch a competitive bid process where we will allocate $8 million in additional funding to community organizations primarily serving the African American, Latino, transgender, and substance user communities in order to strengthen the work that we are already doing. We have programs right here at Ward 86 that others will talk about to really continue to help those that sadly we know are homeless. Just last week, we announced our new initiative to help those suffering from mental health and addiction who are homeless on our streets. This initiative, the Heal Our City initiative, will help us to serve, treat, and house those living with HIV and to help prevent new HIV infections. Again, I want to thank everyone here today who is doing the work, including Dr. Grant Colfax, who has been really an advocate and working in this field for so many years, our incredible leader of the Department of Public Health. I also want to thank Brent Andrews and the Positive Resource Center for their work, the San Francisco AIDS Foundation, which had an incredible event and continues to raise money to invest in this effort, the Transgender Law Center, AIDS Legal Referral Panel, and the San Francisco LGBT Center, and of course, all of the leaders of the Getting to Zero Coalition. Your work is truly appreciated, and the value of what you do makes a real impact, as we can see by the numbers that we're presenting here today. It is something that we should be proud of, and yes, the work will continue, the investments will continue to be made, but this is truly an incredible milestone in the history of our city, and I want to thank each and every one of you for your work and your advocacy to get us to this point. And with that, I'd like to take this opportunity to introduce really a champion in this effort, along with his leadership on the Board of Supervisors, this and so many other incredible issues that we need to address in San Francisco around mental health reform and others. Supervisor Rafael Mandelman has been a real champion and will continue to be an incredible force in addressing this issue as well. Ladies and gentlemen, the Supervisor for District 8, Supervisor Rafael Mandelman.
Thank you, Mayor Breed. Thank you for your tremendous leadership on this and so many other issues. As I walked in today, I had a couple of thoughts. One is, every time I walk into Ward 86, I get a little bit verklempt because of the tremendous history of this place and the amazing work that has been done here for decades, and then the amazing work that continues to be done to chart a new path to actually get us to zero. I am such a fan of Dr. Gandhi and of all the folks who gave me a tour earlier this year or last year. I don't remember exactly when it was, but this is just an extraordinary place. And then walking in here and seeing this collection of the city's public health talent, yes. I am just, we are very, very lucky. So yeah, they deserve some applause for the work they do each and every day to keep this city healthy and make it healthier. This report has fantastic news, and dropping under 200 reminds me a little bit of 21 years ago at this point. I am old enough, as some of you are as well, to remember when the Bay Area Reporter had its first no obits issue. And now we are trying to get to the next step of no deaths and no new infections. And to the folks who conceived that several years ago and have been pushing for that goal, I want to extend profound thanks and congratulations on the success that we've made. And the report, and some of the data. I mean, Aaron Mundy, my aide, got me some of the amazing statistics. But overall, in the city, 94% of people living with HIV are aware of their infection. I mean, that's an extraordinary number. That is not true in the rest of the country. There were no children under the age of 13 were diagnosed with HIV since 2005. Babies are not being born with HIV in this city. That is an extraordinary accomplishment. We are getting people tested. We're getting folks into treatment. And that is how we got closer and closer and closer to zero. And that leaves the bad news in the report that we're going to hear more about, which is the persistent challenges and, in fact, the increasing rates of infection among African American, Latinx, folks on the street, folks struggling with substance use disorder and mental health issues. I really want to thank Dr. Colfax and Mayor Breed for the creative thinking that they've brought into that issue. We know that we will not get to zero until we get a handle on really getting care to the folks who are out on the streets, who are living with so many challenges, who you see every day in Ward 86. And I think what the mayor has recognized, and thank you, Madam Mayor, for recognizing it is going to require cross-departmental collaboration, nonprofit, government, private actors all working together to really solve these challenges, but everybody can do their part. And so here at Ward 86, you've come up with the pop-up innovative program to give folks the care they need and They don't have to make the appointments. They just come in and you'll wrap around them and give them everything you can in each of those encounters that you have with them. And so Monica Gandhi moved out of District 8. I'm not very happy about that. But I am happy that you're still in San Francisco and you can't leave ever. And to all of you who've gotten us to this milestone and are going to get us all the way to 0, thank you so much.
Thank you, Supervisor Mandelman. And now to talk a little bit more about the report is the Director of the Department of Public Health, Dr. Grant Colfax.
Well, thank you, Mayor. Thank you, Supervisor. Thank you all for coming here today. It's really great to be back in Ward 86. I was going to use the word verklempt, but Supervisor already did. So, I worked here for over a decade, and I'm looking forward to returning to the clinic to be a clinician also. And actually, I experienced, with many of you, the grief, the sadness, and the advances that we've made with HIV. I started here as a medical student in Ward 5A in 1992 and have seen the progression that we've made and the progress that's been accomplished. And I think whether you're a community member, a community provider, a clinician, a researcher, a member of the press, what I think the legacy teaches us is that it takes a collective vision, a collective effort, priority setting, and understanding what are the priorities in the system to help us do better. And that's the San Francisco HIV model. That's our model, our homegrown model that got us here today with HIV. It will get us to 0. Getting to 0 has the department's full support going forward. And I think as importantly is the San Francisco model for what we did with HIV will also be the model for how we address what may seem like intractable health problems today. Think about where we were 20, 25 years ago. Think of where we started. Who would have thought we're getting below 200? We still have much more work to do. We must be bold. We must be innovative, both with HIV and with mental health and with substance use and with addressing the intersection between health and homelessness. And speaking of bold vision and innovation and getting us to where we need to be, one of the key people in this city who's doing groundbreaking research, Dr. Hyman Scott of the Public Health Department. Dr. Scott.
Thank you, Grant, and thank you for inviting me to say a few words about some of the work that we're doing and the focus on really addressing disparities in our epidemic in San Francisco. I'm a clinician here at Ward 86. I came to San Francisco because this was the model of how you take care of people as they come, and I think that our focus on disparities really has to focus on ensuring that we reach people where they are and that there are no hard-to-reach populations. They're just hard to deliver services, and that we need to rethink the way that we approach some of those services that we deliver. I think pop-up is a great example of that. Some of the other street medicine and other opportunities to expand PrEP and treatment outside of the four walls clinics. And so although my focus has really been on PrEP, and we've seen overall increases in PrEP use and continuation in San Francisco, we have seen lower rates of uptake among Black MSM, for example, about 10% lower race than other race and ethnicities. And in 2017, that was the case. And in 2018, it does look like that gap is closing. We've also looked at some of our data across our primary care clinics, and it does appear that when people start PrEP, they don't always stay on PrEP, and that the average duration on PrEP is only about 8 months, despite continuing risk for HIV acquisition. And so we know we take care of individuals after they've been on PrEP and have stopped PrEP. And some of the barriers that people have are related to access, to cost, insurance changes, perceptions of risk, and discrimination. And I think we really want to support people as they initiate PrEP in their communities with their providers to ensure that people who want to access PrEP can stay on PrEP. And we also have a focus on ensuring that the systems in which people receive care, particularly for PrEP and treatment, are affirming places, and that we address some of the structural issues, including structural racism, that a lot of our San Francisco Franciscos are experiencing in the health systems. So we're really excited about the opportunities of these new efforts to really address these social determinants of health, which are really driving many of these disparities and preventing us from closing those gaps. But I think if any city, any jurisdiction in the country can do it, we can do it here in San Francisco. Thank you.
So thank you, Dr. Scott. And I just want to emphasize the focus on health equity, right? We must make sure that we drive down the inequities that we're seeing in HIV as well as other health inequities in San Francisco. And it's been a privilege to serve under Mayor Breed, and this is a priority of the department going forward. And I also know that we can't do this alone, right? The health department is a key piece of this work, but it also takes partnerships. And one of the great things about San Francisco is the partnership that we've had historically with UCSF. And I really want to, it's my great honor to introduce a leader, an internationally known leader in HIV research. And she really brought the model that was being used internationally and successfully. And I was able to be part of those early conversations about, well, what's going on locally and how do we turn the tide locally and what do we need to do? So I think that key commitment of UCSF and the key commitment of Professor Diane Havlier in her team, making sure that we're not only looking internationally, but we're keeping it real and looking locally. Dr. Havlier has been an amazing advocate, a key supporter of Getting to Zero, and she's going to talk a bit about her vision for today. Thank you, Diane Havlier.
Thanks. It's really an honor to be here today. And I'm going to be talking on behalf of Getting to Zero. So what is Getting to Zero? Getting to Zero is a consortium that brings people together from diverse sectors and from diverse communities with the common goal of ending the AIDS epidemic. It's completely built on the spirit of San Francisco because it requires collaboration, volunteerism, and action. So the report that came out just a few minutes ago is our report card. It is how are we doing in getting to zero with our goal to end the AIDS epidemic in our city. So one of the logical questions is, well, what is the Getting to Zero Consortium? What's their response to the report? So on behalf of my co-chair of the steering committee, Dr. Susan Buckbinder, many of the members of the steering committee that are here, we want to share with you our reaction to the report. So we are pleased, but not satisfied. So we are pleased because we broke the 200 barrier. And just to say that in San Francisco over the last 5 years, new HIV diagnoses have gone down by over 50%. I don't know if you know this, but in the United States, it's been completely flat. We are pleased because people are starting treatment sooner. Many of them on the same day in a program that was pioneered here in our Ward 86. And a couple of years ago, this was just simply unheard of. And we are pleased because people from all around our country, all around the world, come to San Francisco, to the health department, to Ward 86, to learn what are we doing? How are you guys getting these results? And as we say in San Francisco, what starts in San Francisco doesn't stay in San Francisco. So, but we are not satisfied. And I'm just going to go back to the 200. We're not satisfied because we had nearly 200 new diagnoses of HIV in our city, and it's a preventable disease. And then secondly, we're not satisfied because of these disparities. You've heard some of the statistics and maybe some more. African-American HIV-infected male, his mortality is twice that of his counterparts. And just this year in new infection, 39% were from the Latinx community. So we have many disparities. Okay, so getting to zero, we're making the strategy. What are we going to do about it? So let's start with, we have to double down on these gaps that we're seeing. And what we need to do that is we just need to listen. And that's one of the things we do in Getting to Zero. We convene people together. We put the problems out there. We have multi-sector discussions. How are we going to work on this? So we need to listen. We need to deploy new innovative approaches with tools that we have, with PrEP, and with upcoming tools like long-acting injectable therapy, which could make it a lot easier for some of our populations. And finally, the biggest challenge, we are going to partner with the mayor's office and all of San Francisco for the structural barriers to care. We know what those three are. inadequate gaps in housing, mental health services, and for substance abuse. So that's what we're going to do. You know, I've been working in HIV. I came here in 1984, committed to the AIDS epidemic for decades. And HIV, make no mistake, it is a conniving and very successful virus. And I know that we can reach our goals, and I just want to put forth for us that have been working in HIV for decades, these are the questions of our time. Should we invest to end the AIDS epidemic? Can we end the AIDS epidemic? Will we end the AIDS epidemic? And on behalf of Getting to Zero, our answers are yes, yes, and yes. And we think we can do that because we're San Francisco, and just look around here because we're in it together. So that's what I wanted to share with you on behalf of Getting to Zero. So now I'd like to turn the podium over to a colleague, Dr. Monica Gandhi, who is the director of Ward 86. And one of the huge structural barriers that we're addressing is the homeless population, and Monica's going to talk about pop-up.
So it's really an honor to be here. Just to tell you a little bit about the history where you're standing right now, we opened Ward 86 in January of 1983. So this is the oldest HIV clinic in the country. And then across the street, simultaneously opened an inpatient ward, 5B and then 5A. And many innovations in HIV care have come from this clinic. So a lot of the investigational therapies in the 80s and 90s were tested here, universal antiretroviral therapy starting way earlier than the rest of the country or the world, a rapid program, as Diane mentioned, and a PrEP program. And we know that many elements that are key to success for people living with HIV are challenging if you don't have a place to live. So that would be like making and keeping appointments, particular set appointment times. Where do you store your medications? Where do you keep them safe? How are they not stolen? Maintaining safe sex, healthy eating. All of these barriers are to taking your medications every day are amplified 100-fold if you don't have a home. And so in addition to implementing all these innovative treatments that we've done here, we did start the pop-up program, and that was in January of this year. And I'm going to tell you about the pop-up program, but just mention one statistic from this report that was released a couple of minutes ago that's so relevant to the pop-up program, that among people who are homeless living with HIV in the city, the virologic suppression rate, the goal of therapy, is 34%. And among those who have homes, it's 74%. So that's an incredible discrepancy in terms of virologic suppression rate. And that's what needs to be addressed, like programs like pop-up. So we aim to reduce that vast discrepancy in virologic suppression rate and also reduce the vast discrepancy in mortality. People who are living with HIV who are homeless are 27 times more likely to die than those who are not homeless. So what does pop-up do? So the idea is that people were actually coming to this clinic. They just weren't coming to the primary care appointments. They were coming here for urgent care. They were coming in to get food or to be warm for a minute or to look at their foot, or they were coming in anyway. So the idea was to harness the drop-in program of Ward 86 and to have a pop-up clinic form around them. And it is like a pop-up restaurant where it's care that is designed specially for them. The pop-up clinic is composed of 2 or 3 designated MD providers. Liz Imbert leads the program, a social worker, Jack Kelly, and a nurse, Lizzie Lynch, and our nurse manager, Jan Oscarson. And it is a certain group of people who pop up around the patient, provide primary care, provide vaccinations, provide STD screening, provide pill boxes for antiretroviral therapies, provide vouchers, provide food, provide warm clothing, provide hygiene kits. All of that is done in the context of no appointments. It doesn't make sense to have a Tuesday at 3 p.m. appointment when you're living in an encampment. So they can come anytime in the afternoon, anytime. They go to the front desk, they avoid lines, they say, oh, you remember the pop-up clinic, and our group forms around them and does this very tender, loving pop-up care. And it has been successful so far, and I hope to tell you about that in a later forum. There is no way that reaching this last 10% and reaching these last 197 people and reaching the group that we need to reach isn't going to be resource intensive. It's resource intensive, but it's worth the resources to bring all these innovations in prevention and care to this last group of people who need it. And so we think it's going to be effective, and we hope to tell you about it more later. And thank you for supporting Pop-Up and Word 86.
Again, thank you to all the incredible nonprofit workers, organizations, and the folks right here at Ward 86 and in general for your hard work and commitment to get us to this point. Really proud of the work that you have done, and also appreciative of the fact that you recognize that we need to be more deliberate in how we target specific groups that are disproportionately represented in these new numbers. We still clearly have work to do, but I do want to celebrate and appreciate the milestone set here today, because the fact is we got to a place that was not of some place that anyone ever thought was possible. Just like getting to zero, people are thinking, well, is that really possible? It is really possible because of the work and the investment and what we're planning to do right here in San Francisco. And I can't think of a better city to lead the way in this effort. And I'm positive that we will get to zero. So thank you all so much for joining us here today. Dr. Gandhi, question for you. Could we get an update on the enrollment in the Colfax clinic?
Yeah, so we just started in January. So at this point, there's about 65 patients in the program, and we need to reach about 180 to 200 in our own clinic, let alone anyone who's homeless living with HIV that we'd like to reach through pop-up. So ways to go. We're doing this a little bit on a shoestring budget at the moment. And then of those patients, 87% use methamphetamines, and none of them have virologic suppression. That's a rule of the pop-up clinic.
Can you just, I haven't seen a report that comparing homeless with HIV to last year?
It has not changed at all, essentially. So last year was 33 and 70, so it's not changed. We haven't made that dent yet. Yeah. Thank you.
I was wondering if you have a certain year that you're hoping to hit zero by.
I meant to say that. So we had this goal of 90% reduction in like 5 years, around 2020. So when we started, somewhere around 300. So we have to get to 30. Okay, so we are, the curve, the decline is going in the right direction. But in order for us to continue the decline, we're going to have to address what everybody talked about today. And once again, I really want to emphasize, like in the United States, it really is shocking that the curve is flat, okay? And that's because there hasn't been the investments, there hasn't been the innovation that we've been making here.
So do you think you'll hit the 30 by 2020?
We will try.
Any other questions? One more here. What do you think your barriers are to be able to get to 30?
Susan, do you want to do? I mean, I'm happy to do. Okay. So, I think that you have heard during this press conference many of the themes from all the speakers. Okay, so we have to be able to deliver care in a way that addresses the disparities we have in populations. That's number one, and that intersects with three things that I know that the whole city is working on: housing shortages, mental health services, and substance use services. So if you'd want to ask, I probably think we all look at things a little bit different. We'd all probably agree that those are the main things that we need to do going forward.
Time for one more question? Thank you for that question, Dr. Colfax.
Yeah, just thank you for that comment. I just want to emphasize that the San Francisco Department of Public Health shares the concern about providing trauma-informed care, and that's been a commitment for a number of years. And we strongly believe that you can't fully address someone's HIV, their substance use, their mental health issues, or in some cases their life on the street to get them into shelter or navigation center or housing without bringing a trauma-informed approach to care. That's a key part of what the department's been working on. We've actually trained over 8,000 people in the department and some community providers in trauma-informed care. I also want to link the broader question of how do we approach the disparities in HIV infections. If you look at the mental health, the substance substance use, the housing inequities. This is not just about HIV. This is about our approach as a system. And if you look at the mayor's announcement from just a few days ago on the focus on the 4,000, and the same principles that we're addressing here, the same issues around inequities, the same focus on data and driving down the numbers, and it takes hard work. I think sometimes we think, oh, there should be some fancy fix overnight, and we should be able to reach into the sky and bring something, and it solves this. This has been a 30-year arc for HIV, but look at where we are today. And I think if we use the same principles in focusing on the populations that matter the most, invest in those resources, follow the data, and bring collective effort forward, we will be even further ahead. We will get to zero with HIV, but we also made progress in those seemingly intractable problems today. Thank you.